The next session is a very exciting one. I think it's leading up from what we spoke about, especially from the fireside chat conversation from Marie and Fiorella, and what Dr. Fernandez was speaking about, leading up from building up from the need for bladder cancer patient support, and then how do we get there, and some examples that were shared of the work is done in Argentina, how World Bladder Cancer Patient Coalition also supports patients and carers and all stakeholders willing to start a group in their own country. And so now we're going to talk about how do we start a bladder cancer patient group from scratch. And we have two wonderful speakers. We call this session the style of a thematic duo. So we have two very exciting people who have started their own bladder cancer patient organizations. Laurent, who has just launched a bladder cancer patient organization in Spain called CANVES, and he'll tell you more how does that spell out exactly. My Spanish is not that great. And then followed by that, we'll have Stephanie Demkiw. So Stephanie also co-founded Bladder Cancer Awareness in Australia. So we have an opportunity to learn from two great examples of starting a group from scratch and from the need. And following that, we'll have an opportunity also for Q&A discussion, both with Laurent and Stephanie, both in person and online. So keep your questions for the end. And I will invite then Laurent now to come to the stage, please.
This one. Oh, okay. Hola, buenos días a todos. Me llamo Laurent y soy el presidente y cofundador de CANVES, Alianza por el Cáncer de Vejiga en España, y paciente de cáncer de vejiga también. Para mí es un honor de estar aquí con vosotros hoy. Y bueno, antes de todo, me gustaría empezar resaltando la importancia de los grupos de pacientes. Estos grupos no solamente ofrecen un apoyo emocional práctico a los afectados, sino que también juegan un papel clave en la concienciación, la defensa de derechos de los pacientes, el asesoramiento, y la promoción y la investigación de tratamientos innovadores. Para la gente que no me conocen, voy a contar un poco mi historia y las orígenes de CANVES. En octubre de 2022 cambió mi vida drásticamente cuando me descubrieron un tumor en la vejiga. A este momento no sabíamos si era maligno o no. Tras varias pruebas, análisis, RTV, los resultados confirmaron que era maligno. Mi doctor a ese momento me ha propuesto un protocolo de conservación de vejiga. Este protocolo lleva un seguimiento muy estricto, con revisiones cada 6 meses. Afortunadamente, hasta ahora no hizo recurrencia y sigo con este protocolo. Esta experiencia personal y la falta de información me hizo consciente de la necesidad de una red de apoyo en España, una red de apoyo que a este momento no existía. Ahí llegamos a la creación de CANVES. Nuestra primera conexión fue con la Asociación Francesa de Cáncer de Vejiga, CANVES France. Como el francés es mi idioma materna, he podido interactuar con ellos fácilmente. He visto a través de un grupo de Facebook cómo interactuaban pacientes y familiares, intercambiaban ideas, se apoyaban. Todo eso demostró el poder de una comunidad. Después hemos conocido la coalición mundial. Nos han invitado al foro el año pasado en Madrid. Ahí hemos visto otras asociaciones de otros países. Entonces, estábamos ya convencidos que faltaba algo similar en España, que no existía. Gracias a CANVES France y a la coalición mundial, hemos encontrado al doctor Durón, un doctor que a este momento quiere hacer lo mismo en España, crear una asociación de pacientes de cáncer de vejiga. Tras varias reuniones, hemos decidido de empezar y hemos creado CANVES. Hay que tener en cuenta que en España el cáncer de vejiga es el cuarto más frecuente para los hombres, que tiene una alta incidencia con más de 23.000 nuevos casos al año y que es muy poco conocido. Teniendo todo eso, hay que empezar. Pero ¿por dónde empezamos? Que siempre es lo mismo. ¿Por dónde empezamos? Bueno, hay que buscar un nombre y una identidad visual, un logotipo. Tiene que ser sencillo, fácil de uso, comprensible. También hay que ver el ámbito. ¿Qué queremos? ¿Nacional o local? Para nosotros fue muy claro que queríamos algo de nacional, porque los pacientes del norte como del sur tienen los mismos derechos y las mismas expectativas. Hay que identificar quién está interesado a participar en una asociación sin ánimo de lucro. Pacientes, familiares, profesionales. Hay que determinar los objetivos, el apoyo y los recursos a los pacientes, la sensibilización y la investigación para nosotros. También hay que buscar la financiación. Podría venir de donaciones, podríamos preguntar a compañías farmacéuticas y también patrocinadores. Para llegar a estos objetivos de apoyo, de concienciación y de investigación, hemos pensado crear materiales educativos como folletos, campañas en redes sociales o medios de comunicación. También utilizar el mes de mayo, que es el mes de cáncer de vejiga, como mes de concienciación. Queremos también organizar eventos y conferencias. Conferencias nacionales sobre el cáncer de vejiga, donde interactúan pacientes y profesionales. Eventos, actos benéficos para recaudar fondos. Queremos también crear grupos de apoyo con programas psicológicos y emocionales para los afectados. No solamente los pacientes, pero los familiares también que están impactados por la enfermedad. Queremos también colaborar con las asociaciones nacionales e internacionales, como lo hacemos ahora con vosotros. Pero todo eso siempre en el mismo espíritu, siempre para marcar la diferencia en la vida de los pacientes. Aquí podréis ver un folleto que hemos diseñado ahora con informaciones sencillas y que está ya en varias consultas. En conclusión, CANVES ha nacido de una necesidad personal y colectiva y quiere marcar la diferencia en la vida de los pacientes. Pero todo eso no ha sido posible sin el apoyo de profesionales, de familiares y otras organizaciones. Gracias.
Hi, everyone. Let me just do this. My name's Dr. Stephanie Demkiw. I am from Melbourne, Australia. I am the co-founder of Bladder Cancer Awareness Australia, Australia's first advocacy group solely dedicated to bladder cancer. And in my day job, I am a general practitioner in Melbourne. Okay, so we're going to start with a little hands up exercise. And I want everyone who comes from a country that has a bladder cancer organisation to please raise their hand currently. Put mine up as well. Okay, great. Keep your hands up there. Have you had this organisation for 5 years or more? Yes. Okay. Few hands have dropped. 10 years. We've just celebrated our 10-year anniversary, so we can keep our hand up. 15 years. Okay. I was going to do 20 years, but we can stop there. Great. So basically, my story in a nutshell, to give you some context, is my father was diagnosed with a very aggressive form of bladder cancer and had metastatic disease. He passed away in 2013 at the age of 66. At that time, I was working in urology, so I was training to be a urologist. Since then, I've done general practice training. But there were no dedicated bladder cancer support groups, charities, anything. There was a lot of prostate cancer stuff, but nothing for bladder cancer. So my sister and I said, oh, maybe we should just start the first one. So that's what we did. So I guess I'm here to tell you that it's not as overwhelming or as unachievable as you might think. So I've broken it down into 6 steps in order to start a new organisation. So let's do that. Okay, so the first step 1, is understanding the landscape in your country. So I like to call this the data and the reality. So before you can advocate for change, you really need to know what the current situation is. How prevalent is bladder cancer in your country? What types are most common? Who tends to get it? Established risk factors, resources available already for a more general cancer population, things like screening programs and the government's role. You can get data from hospitals, broader health organisations like we have the Cancer Council Australia, and then international bodies like the WHO. And that helps you kind of identify your target population, subpopulations, and things like gaps where help is needed. The reality, so I've put up the little Venn diagram there of the circles with a little emoji of myself in the middle. That's sort of that biopsychosocial model of health. So health is more than just diagnosis, disease, mortality, morbidity. It's, you know, the psychological impact of that disease, the social impact, and then in turn, the social and psychological side of your own life and how old you are, whether you've got children, what you're doing, that also impacts how the disease affects you. Let's go. I'll also say the WBCPC's Patient and Caregivers Global Survey has really been fundamental in identifying some of these psychosocial gaps. So we touched on anything from mental health, emotional well-being, relationships, sexuality, finances, you name it, pretty much everything is considered. So it's really wonderful if you're starting up a new organisation. The next step is to build a coalition. So the whole idea that a unified voice is always stronger than a single one, and together we are stronger. So you really need people who are going to share your vision and your passion. So the first group is cancer survivors and carers. They're sort of the key group in any advocacy organisation. You know, they come with a personal story which often resonates with others. They can draw attention to the need for the awareness and support in quite an emotive way. I also find in my experience that the patients and the carers will bring their own outside skills to your organisation. So one of our volunteers is an extremely talented graphic designer. She does all our graphics, our media. She's been invaluable. We've had people in PR and events, art industry, research, accounting. You know, it all can add to what you can do in your organisation without sort of adding too much cost, which is amazing when you're starting up. Involving healthcare professionals. So I guess I had the bonus of being a healthcare professional myself. I was linked in with a lot of urologists. So that was a bonus for me, but you know, that's really important to sort of bringing that expertise and credibility to your cause. And then the third group was sort of partnering with more general not-for-profits. So for us, Cancer Council, other sort of cancer associations in Australia, but then also international organisations like this beautiful umbrella group, WBCPC. And if you have no idea where to start, I would say engaging in an online community such as Facebook, and you could just inquire as to whether somebody else would be keen to start a more formal advocacy group. And you might surprise yourself and find that there's actually a few people out there who have the same idea, but they sort of don't know where to start. The next step is to define your mission and goals. So I've popped up some of the World Bladder Cancer Patient Coalition sort of vision and goals up there. But usually these are around whether you want to increase public awareness, advocate for better treatment, support networks, policy change, or research. And I think you keep them simple but impactful, and make sure that the people you're working with, your immediate coalition who's going to be doing the work, is aligned with sort of your idea as well. At BCA, we often review our goals and missions sort of once a year. We look back and see, you know, over the last 10 years, we have evolved quite a bit. Initially, we set out to support awareness campaigns and bladder cancer research. But now, as time has gone along, we've touched much more on that psychosocial side. We've had the pandemic, and, you know, people were really missing that person-to-person contact. So we kind of focus a lot on that. Then we've got step 4, which is create a legal organization. So this is a kind of, I don't want to say the boring part, but this is like the reality of it. So it's going to vary country to country, but for example, in Australia, we have the ACNC, which is our like overarching governing body for any non-for-profit or charity. They had a multitude of information on where to even get started, what you need to consider. But in terms of legal stuff, you know, you need to think about how you're going to set up your organization, whether it's going to be quite formal, incorporated, whether it's going to be more club-like, whether you're going to, you know, you've got to consider things like your business number, your business name, registering those things formally, bank accounts. Then there's also things like you need to set up your formal governing document, which in Australia is publicly available. That will include things like whether your donations are tax deductible, and that's a whole separate process. I learned a lot in this journey, you know, it was a big eye opener of how much admin is involved. And then things like the duties of the responsible person, appropriate handling of finances, also a dissolution clause. So basically what would happen if your organization, for whatever reason, was to no longer exist, you need to spell out X, Y, Z. So for us, if we were to close or no longer exist, our assets are going to be transferred to a charity with similar objectives or purpose. That's sort of what we have spelt out. And then also the considerations around the branding, logo, website, having all that done. And then step 5 is to consider and secure funding. So are you going to use a single source, multiple source? Again, often changes with time. A lot of the time, which was our case, we started self-funded, but that's not really sustainable for, you know, moving forward. So we use a combination of fundraising activities, which is through events, merchandise. That's quite a good stream of income for us. Donations are always very welcome, and we do have quite a few private donations. And then we have applied for different government funding or grants through mainly corporate, pharma and industry. We don't have any membership fees, but some people consider membership fees. And then the last step is to sustain your efforts. So starting the group is really just the beginning, and sustaining it is where the real work happens. For long-term success, you need to think about having your funding, securing your funding. So looking for sustained grants, donations, partnerships. Number 2, develop leadership. So this is something I wish I did much earlier in the piece. You know, I sort of took it on and thought I can do all of this myself, you know, all the nitty gritty and all of this. And I was trying to be a doctor on the side. And then I've had 4 children since, and it's a lot of work. But to train and empower more people within your organization to take on roles that you otherwise would take on yourself, I think that just helps, you know, create a stronger foundation and prevent burnout for individual people who normally would do only one role, for example. Third one I've said is just to monitor your progress. Again, we review, like we do a big review once a year. And, you know, to really know whether there's been any impact, we need to look at, you know, are more people getting screened? Has awareness increased? How are people going from a mental health point of view? All of those things. All right. It's just some pictures to keep it interesting. So I guess starting a dedicated bladder cancer advocacy group in a country where one does not exist is really challenging, but I would say an incredibly rewarding experience. And it's both a personal and professional experience. So I just wanted to finish up on the two most important pieces of advice that I was given in the early days. Number one is to just get started. So make it tangible, grab a piece of paper, start jotting some thoughts down about what it would look like, get something into motion. And anyone can do it. And as Walt Disney would say, if you can dream it, you can do it. So you just need to start. It's like doing an essay at university or something. You just need to start. There's a picture of my dad and my sister. The other really important piece of information was that you don't have to reinvent the wheel. So, you know, I think I've got a quote up there, you know, outside of passion, the key to establishing a successful patient advocacy group is collaboration. There are so many, we're so well resourced with the World Bladder Cancer Patient Coalition. You'll have someone to answer any question you have, any problem. It's really quite amazing. So in conclusion, change may not happen overnight, but your efforts can lay down the foundation for a future where no one has to fight bladder cancer alone. Thank you.
Now it should work. Yeah, perfect. Well, Laurie, perfect.
For both of you, how did you overcome the initial challenges? What was the best strategy for you when you faced challenges in creating your organizations? What was the thing that helped?
Hello. I would say at the start, it feels very overwhelming. There is a lot to do. The thing that helped me the most was just break it down into little bite-sized chunks and just chip away. You know, there wasn't any group initially. So any little part that you can do that's moving you towards a group is heading in the right direction. And you don't need to have everything set up and ready to go overnight. You can just chip away over weeks and months. And then, you know, you blink your eyes and it's been 10 years, you know. So that's what I would say. Just don't let it overwhelm you. And ask for help, which I wish I did more of back in the early days.
Sí, creo que hay que ir con tiempo, cada cosa en su tiempo, poco a poco, y no intentar de hacer todo de un golpe. Hay que preguntar y si tenemos preguntas, hay que ver a quién dirigirla. Y se podría a profesionales, a otras asociaciones, pero siempre con tiempo, que no que hay que adelantar las cosas.
Thank you. I also have a question. On, you know, creating an association is a big task as well, and I think both positive and challenging for you both. I was wondering whether the creation of the association had an impact on you personally, on your personal life as well, and how that was positive or challenging. I guess the question, both of you, just to share.
Yes, I would say absolutely. So I think one of the common themes you see from all these organizations all over the world is that they have come from a very personal place. Often it is a patient or a caregiver who says, why isn't there anything available? And they get something going. And that was obviously the case for me. Yeah, it becomes a huge part of your life. You know, it's almost very hard to say, you know, the charity and the group is not my job per se. I do have a job and a sort of life outside that, but it is so heavily intertwined in my personal life. You know, I have 4 children. They've often like helped me at events and things like that. I think it's really important to get your family involved and just sort of teach that next generation about, you know, the way forward. I think it would really, you know, I'm a medical professional, but I think it's almost impossible to take out that personal emotive side to it. And I think that's what makes it so special and so powerful. And yeah, it's been really amazing.
A ver, no.
That's better.
Pues lo que es, bueno, lo que estoy intentando explicar es que como mi marido me ha apoyado en todo y es una iniciativa junta al final de crear la asociación en España. Y pues sí, es que solo no se puede hacer tampoco. Y bueno, no tenemos hijos, pero claro que eso te coge mucho tiempo al final, y que no es tu actividad principal, es algo que haces sin ánimo de lucro, y que hay que, bueno, que hay sí, es que es eso, es que son momentos que al final está compartido con gente, pero que son de privacidad tuya, pero ya, creo que es eso. ¿No?
Perfect. Last opportunity for any final questions. Do we have any questions online? No? You want to ask a question?
How was it doing training? Like, how did you do training for doctor? Being doctor.
Hello. You have to do really well at school, and then you have to study for about 10 years and not leave your bedroom. And then at the age of 40 with 4 small children, you can go and explore the world when you do a few conferences like this. So, well, you study for a long time and you learn from older doctors who teach you.